James, you're launching Fine Gael's healthcare policy today, FairCare. Can you tell us the main points of the policy, please?
The main points of the policy are, number one, to end waiting lists using the same initiative they used in the north of Ireland, where they got rid of a 57,000 person waiting list in 18 months. It's also to develop primary care, putting in place incentives to build centres where doctors can work together with specialists with access to diagnostics like X-ray, ultrasound, endoscopy, so they can be diagnosed and treated in the community, thus ending long waits at A&E and at hospitals. And we're also going to bring in universal health insurance, which will give everybody free GP care. And what that means is you will no longer have to pay your doctor when you go for a visit. That will remove the worry from families who have sick children or who are ill and put off going to the doctor, trying to make a decision as to whether they pay the ESB bill or go to the GP. So what we intend to do is also, this will result in ending the two-tier system, which basically means that everybody will be insured, everybody will be treated the same, and with waiting lists gone, everybody will be seen quickly and will be looked after in the same way as the next person. We don't believe in a two-tier society. We have seen how people have tried to create a two-tier legal system. We have a two-tier medical system. We want to get rid of it.
Now, funds are pretty low. How will free GP care be funded?
It's very simple, really. If you think of what they pay in Holland at the moment, and they have an excellent system, the very system I'm talking about, where they can see their doctor the same day and they can see a specialist within a month. They're only spending €3,500 per head. We're spending nearly 5,000. So it is within the envelope of money we have already. It's a matter of gaining efficiencies. By money follow the patient system, where hospitals only get paid for the patients they see, for the surgeries they perform, you can save 10%. Now, we spent 5.5 billion last year in our hospitals. That means we could save 550 million annually in the running costs of our hospitals to reinvest into the service.
Now, you're taking FairCare on the road with your team. What places are you visiting to tell the public?
We're going to be going along with Senator Francis Fitzgerald and with Deputy Dan Neville and Senator Nicky McFadden. We'll be visiting Dublin, South Kildare, Kilkenny, Cork, Galway, Mullingar and Limerick.
And people can find out where you're going to be through Facebook and through the website.
Yeah, it will be advertised, and we'll have a poster campaign before we arrive in each town as well, our city.
We've already had a meeting in Drogheda and in Dublin, and we've had a great response from people at the meetings. A couple of hundred people turning up to the meeting, asking all the questions they have about it, because this is a radical new approach to healthcare in Ireland and ending the two-tier system.
So everybody's welcome to come, and any questions they have they can put to one of you or all of you, is that right?
Yes, we take questions, and people are really interested in this because everyone wants to see change in the health system and the way it's delivered, because it's not working at present.
I was in the Royal College of Surgeons last night at the 200th anniversary of their Charter Day, when they moved to 123 Stephen's Green, and morale amongst doctors is very low. They've never seen the system so broken, and to a man and a woman, they want to see change too, I believe, even though they don't say it out publicly because many of them feel it's not appropriate for them to speak. I think it's very important too that in our primary care centres people realise there will be a mental health facility, so that I'm sure Dan Neville would like to say a word about that.
Well, we feel that the mental health is the most neglected area of our health system. It has been ignored for centuries, for decades, and we are probably one of the lowest percentage of our health budget in Europe allocated to mental health. We see fair care, including mental health, and that the efficiencies which will be introduced through fair care and the new professionalism introduced to it will also apply to mental health, even though we feel mental health has much further to go than the general health services.
And that's particularly important at times like this of recession as well, isn't it, Dan?
Well, it is, yes, but mental health becomes more important during recessions because, you know, when people are under pressure, losing employment, losing their homes, or in danger of losing their homes, there's a higher level of mental health problems, there's a higher level of depression especially, there's higher levels of suicide, attempted suicide and self-harming because of the pressure that families are under, that individuals who have lost their jobs are under, and the inevitable difficulties created in relationships because of the stress caused by the change in the economic circumstances.